I'll go ahead and get started then. This is first of all, thank you for having me, letting me speak to you tonight, maybe even answer some questions you may have. Bear with me because I recognize some of this is going to be new information, and I'm going to give you a little bit of background. There's obviously a lot that's been going on with this since it started back in January, February. So just kind of bear with me as we get started through this. But I'll go ahead and just jump right into it. In terms of what this is, COVID-19 is a virus, and this is just kind of the family of the string of viruses. People get confused and say, well, I've heard it's a common cold virus too. Well, it's got cousins that are common cold viruses. That's not the one that's wreaking havoc for us. And it is related to the SARS virus. It's also related to the MERS virus, which has caused epidemics around the country. This is certainly a new strain that we're seeing that started in China, from what we can tell, back at the end of November. So it's a virus. It's not a bacteria. It's not a fungus. Why that's important is because it requires a host. It has to be able to reproduce within a body. It can't do that on its own. And so how do you get infected by this virus? Well, it gets into your body through the nose, the eyes, the mouth. It moves into the lungs, and that's where it reproduces. Unfortunately, with this virus, we find that it can now get into the bloodstream, and it can spread into and affect the heart, the kidneys, the brain, liver, and even the bowel at some levels. The issue with this virus, and the biggest problem we're having now, is that it's highly contagious. It's an extremely contagious respiratory virus. We're finding out more and more that it can hang out on surfaces for more than we initially thought. It was 72 hours or longer. Now there's some studies that show up to 9 days. It can hang out in the air for a couple of hours. For people that are coughing or sneezing out into the air, it can live on surfaces, as I said, for quite a while. We're saying it's kind of a, quote, sneaky virus. And what I mean by that is you can get infected by it and your body doesn't pick up on it. So your body doesn't mount a response immediately. That allows the virus to actually reproduce and then spread to other hosts. And so that's where you get the term asymptomatic spreader. It can actually get into your body and it can actually replicate before your body even knows it. And so it's got an interesting way of kind of avoiding your body's defense mechanisms. The groups that are the highest risk for severe disease are any individuals over the age of 65, or really anybody that takes a medication prescribed by a physician for any reason, whether that be high blood pressure, heart problems, or any of the things listed there. We know those groups right there are at higher risk. Asthma is one of those that we're also seeing. That's a new group that's kind of emerging. And oddly enough, there's a strange group of young individuals that have no medical issues at all, that for the most part are in really good health. And what happens in those individuals is actually the body over-responds. The body gets really mad and creates this huge immune response, and then it just starts basically breaking itself down. And so the body starts attacking itself. And so it's called cytokine storm, and that's an issue that we're seeing that we don't see with most viruses. So that's alarming. So what do we do for COVID-19 to protect ourselves? Well, you've seen most of this. This has been out by the CDC. It's been out in a lot of the media publications and things in terms of hand washing. Don't touch your face so the virus can't move in. The wearing of masks in public is something the CDC put out just in the past few weeks, and that protects you as well as others around you. You've heard a lot about social distancing, I'm sure, and the idea behind that is to limit the number of people that the virus can infect. We don't have a lot of ways to actually treat this, so these are our best tools. Testing, unfortunately, has been very limited, and we haven't really done a great job as a country in terms of getting the tests that we need and getting them to the needed areas. I think that's getting better. I think it's certainly a lot better than what it is today than what it was even just a few weeks ago. There's an antibody test that's out, but basically it can tell you if you've been infected, because there are a group of individuals who got infected by this and maybe didn't have many symptoms at all or even recognized they were sick. We're not quite sure how reliable that is. It's still a fairly new test, and there's still a lot of information coming out about it. As I mentioned there, Dr. Fauci, who's kind of our national infectious disease expert, he kind of weighed in on it just earlier this week about that test. So how do we fight this virus? Well, we don't have any medications right now. There's about 300 different trials going on. Obviously, we launched into a bunch of research, but research takes time, and you have to go through multiple trials, and you have to get lots of people on board, and you have to give some people the medicine and some people get a sugar pill, and so that doesn't always work out well. But we've got some ideas. There's a drug called remdesivir, which actually was created to fight the Ebola virus. It's showing some really good promise in terms of slowing the spread and actually fighting COVID-19. There's a lot of medicines we already have out there that we've been trying just to see if they can be repurposed. Some medicines we use for HIV. You've heard a lot, I'm sure, about the hydroxychloroquine. New study just came out today out of the VA that showed actually there's more deaths with that drug than without it. And so that's some disappointing news, as we were hopeful that there would be some good information regarding that. In terms of a vaccine, we don't have a vaccine. We have 3 vaccines right now that are promising, that have moved into human trials, and we're hopeful that those will be available by early to mid-2021. It takes a while for us to create a vaccine and then to grow it, because that's what we do. And you want to make sure the vaccine is safe and effective, because it's something you're going to push out to 350 million people. So you want to make sure that it's done right the first time. So it just takes a while to get that. So with no medications and no vaccine, what are we left to do but to limit the spread of the disease? That's really all we've got. And this is not uncommon in a pandemic, especially when it's a brand new virus that the human body's never seen. At least 6 feet or more apart is the current CDC guidance. Obviously, the hand washing and the wearing the mask. Social distancing policies, which most every state in the country has adopted. And the flattening of the curve, which I'll talk about in just a second, because I think that bears some discussion. So I've had people ask me a lot, are you immune after you get infected? So after I get sick with this, am I good? Did my body create a memory cell, so to speak? Well, in theory, yes. But there's some evidence coming out that it says it really depends. It really depends on how your body responded. For some people, they do have an immunity. For some people, not so much, which goes back to the real need for a vaccine and effective treatment. Following some information out of South Korea about 116 individuals that are still recovering that tested positive. We're not sure actually, what that means or what that's going to translate into. I thought this was a great slide, and I've used this before as I've discussed, what this is and why it's so important to flatten the curve. What I want you to understand about this is certainly at the very beginning, back here at the beginning when we say someone gets infected right about this area here, let's say we do nothing. Let's say we just say, okay, look, we don't have vaccines, we don't have medicine, so everybody's just kind of on their own. Then so the virus gets passed around and people get sick. And they get sick quickly. And then the peak subsides. And if you'll see, it comes and it goes quickly. This is if you put social distancing measures in place. The gray curve is. It flattens it out. And so this is the flattening of the curve. What I want you to pay attention to is the number of people here and the number of people here are the same. It's actually the same number of people under each one of these curves. You just change how many people get infected at a certain time. And why is that important? Well, it's the overload on the healthcare system. We only have so many ventilators. We only have so many ICU beds. We only have so many ICU doctors. The other thing that I want to point out too is right here is the peak. So right here is the peak if you do nothing. You move the peak down the road. So the peak becomes here, the better job you do social distancing. Well, why is that a big deal? Well, if we can move the peak, we buy ourselves time. We buy ourselves time to do research, buy ourselves time in terms of creating a vaccine, in terms of maybe repurposing some of our medications to see if they'll really work. So when you hear about flattening the curve and hashtag flattening the curve, this is why this is such a big deal. It gets confusing for the general public, and so we try to put out as much good information as we can to hopefully make it clearer. But this is why we want to flatten it as much as we can, even though in the end, the same number of people get infected. It's just a longer period of time. I'll talk about this in a second, and some of you are probably already realizing this. Does this mean that the virus hangs out in our community longer? Unfortunately, yes, that's exactly what happens. So the virus, when it comes in here, people get infected and they get over it, and it's a shorter amount of time. It's much longer when you flatten the curve. Just a quick update in terms of where we are nationally. We're at about 788,000 infections in the United States, with about 40-something thousand deaths. I'll talk about that in just a second. This map, I think, is good because it shows you where the geographic spread is. It shows you where all the cases across the country are. And I'll come back to that in just a second. How do we look compared to other countries? This just came out earlier this week. We're starting as a country to flatten our curve. Now, there's a caveat there, and there's kind of an asterisk there. We as a country are starting to flatten our curve, and I'll talk more about that in a second as well. What this graph depicts, though, is if you see the stars, now stars are where a national lockdown occurred. Now, the United States is a big country, and each state has their own ability to make these decisions, and so it was different for the United States. These individual countries made their own decisions. And so what's interesting is you'll see that earlier, and the earliest one on this graph is New Zealand, who started it early and was able to flatten their curve and to drop their numbers fairly quickly. Everyone watches China because China's the one where the virus originated, and that gives us an idea of what we can expect or what other countries can expect. Where it goes up, it goes down. You have a second peak, it goes down. You have a third peak, and they're just now reopening their country. So we'll see what happens there as they loosen all their social distancing requirements. In terms of the United States, about 95% of the population is under some lockdown right now. That's about 306 million people. Today, we have about 43,000 deaths over the last 3 months. The first one was reported at the end of February. So compared to our influenza seasons, which can vary depending on if you have a bad one or not, normal deaths are between 25 and 45,000 over a season, which is about 7 months. What I want you to take a look at now is in the top right-hand corner, you'll see that map of the United States. That's based on geographic population. So that's population density of the United States, where everybody lives. Now look at the map below, which we just looked at. You can see where the spread of the disease is. It should be no surprise to you that the more dense the area is in terms of the population, that's where the hot spots are, so to speak, in terms of the spread of the virus. And again, what we're trying to do, as we are in the United States, for the most part, we are flattening the curve in the United States with what we've been doing. Now moving on to Arkansas, let's get more of a granular level of what it looks like for us. Social distancing, the governor's approach, as well as Dr. Nate Smith, their targeted approach has been working. We do have cases on the rise, but it's been slower. It's been slowing down quite a bit. For those of you that watched the governor's press conference today, you'll see that there was a significant uptick in the last 2 days in terms of cases, primarily in the prison system. The prison system is important to realize what's going on there because that's a microenvironment. That system is similar to other systems like nursing homes or extended care facilities. And so looking at what goes on in those areas can give us an idea of what would happen in other areas where you have clusters of people together in a specific area. Now, there is isolation that occurs in the prison system. They do try to remove them. The other piece about the prison system, which I think is important, they were testing pretty much everybody. So even individuals that didn't have symptoms were getting tested, which is something we don't do in the general public right now. Most of you are aware from the governor's press conference last week that right now we have a target date of May 4th, which is our phase 1 target date. I'll talk a little bit about that. This is based on the White House's proposal that was released the end of last week in terms of being able to restart our economy and move forward, which is something we must do. A lot of it's heavily dependent upon testing and contact tracing, and we'll talk more about that. Here we are in the state of Arkansas. I apologize. This was as of yesterday, I believe. It shows 43 cases. We actually have 45 cases in Craighead County now. This is the age distribution, which I think is important. You'll see that the largest percentage of people are between the ages of 25 and 64. So a lot of your working class individuals are the ones that have the disease now. But it's true. The individuals with the most severe disease are ones that take a medication or are over the age of 65, specifically over the age of 80. When we talk about the actual Arkansas numbers, cases by day, this is what the numbers look like. And again, it's about a day or two behind. Right now, as of the press conference this afternoon, and as of the information I got from the ADH about 30 minutes ago, we're at 2,200 cases for the state of Arkansas. This is the same information depicted in a line graph form. And here is a presentation, a copy of the presentation from the governor from yesterday showing each day the new cases over a 7-day rolling average. What's interesting and not surprising is you'll see it goes up, it goes down, it goes up, it goes down. Some of this is actually based on the release date of the tests. So as we have tests, we send them off to the lab, and we get batches of them back. Sometimes that's why you'll see the increase in the numbers there. Drilling down even further to Craighead County, this is what our trend line looks like. I was really concerned at March 28th when we showed up there at the parking lot of the Best Buy right after the tornado had hit about the congregation of people and what we were going to see in terms of an outbreak. I do believe there's been some bump based on that. If you'll look here, this is where we were trending along in Craighead County fine, just kind of holding our own. And then this is where the tornado hit. And this is where you had people out helping neighbors, helping each other, which is what we do because that's part of our community. It's not surprising to see a little bit of a bump. Now, some of this is just normal. Some of this is going to be a natural increase just based on the spread of the virus. Some of this is probably attributed to what happened during the tornado event and the little bit of large cleanup that occurred right thereafter. The nice thing about it, the good thing I'm glad of, is we did not see a spike in the number of cases. So we did not see a significant spike, and this just continues to trend like this. This is just more in a line graph form. Again, you'll see it comes up, we plateau, it comes up, we plateau, it comes up, we plateau. This is a typical trend line. How does this compare to what national data looks like in terms of where we are as a state and where we might peak? I'll be honest with you, there's about 4 or 5 different models out there that show different numbers. And it's all based on different information in terms of what do we do as a state or what do we do as a community, certainly over the next several months. This one shows a peak of April the 30th in terms of when peak resources will be used. This one has been moving forward. This model itself has been moving forward every few days. It keeps pushing it out. But again, that's not a surprise. As we do a good job social distancing, we push the peak out more. And so you'll see it come out more this direction as we continue to do a good job as a state and as a community. This model is the model actually used by that the White House follows, and a lot of individual organizations and institutions are following. I've got mixed emotions about it. I know the governor spoke about it today, and I agree with him in some regard on that. This one, and I'm not sure where they got this data from, this one actually says that in the state of Arkansas that we should look at relaxing our social distancing after June 22nd, which of course is not what our plan is right now. The governor's planning for May the 4th to start back. In terms of when do we really expect to see our first peak, and I think that's important to delineate, we will have other peaks. Our first peak probably will come more earlier mid-May. There is some discussion about June. There's one model that shows July, and I'm still not quite sure where they're getting that from. Some of it depends upon what happens, and what happens May 4th, and what happens moving forward after that. Crittenden County, I've got this here because that's interesting. Crittenden County kind of is a light bulb, certainly in our area in terms of cases. And where that comes from is the crossover, the individuals that live in Memphis. Memphis itself almost has the same number of cases as the entire state of Arkansas. So you've got a geographic area that basically holds almost the same number of cases as our entire state. That means that they have in Memphis significant community spread of person to person, and that's not that far away from us. Just kind of something as a reminder, if we are successful, and we are for the most part, if we are successful in flattening the curve, that means we prolong the presence of the disease in our community. But we don't overwhelm our healthcare system, which is something that we have to be very diligent about watching for. So, and this happened a week ago, I had to actually speak to this. I've got questions about, well, now that we've peaked, what do we do now? Well, we is contextual. We haven't peaked yet. We in the state of Arkansas, we're hoping to peak soon, and we're hoping to get on the backside of it. We in Craighead County have not peaked. We're hoping to soon and be on the backside of it. White House has put out guidance. The Arkansas Department of Health has a work group that's going on right now. Dr. Nate Smith, I've been in contact with him frequently. He is a part of that group. There's also an economic group that's pulled together. We're hopeful that we'll have more guidance within the next week from them because really we're less than 2 weeks away from May 4th when the go-live date should be for the governor's move forward to reopen the state and restart our economy, which is desperately needed, I know. the worry that we have, certainly in the science and the healthcare field, is there's a public misconception that for whatever reason now the virus is gone. I can come out of my house, we can go back to normal, we can do the things we were doing beforehand, and you're starting to hear more about that from the director of the CDC, from Dr. Fauci, that would be a grave mistake and would certainly put us back in the position that we were in just a month and a half ago, which is why the city and the county and the state approach has to be united and has to be uniformed and it has to be consistent. So how do we do this? How do these phases happen? There was, there's specific guidance that's come out for each workforce segment. Screening and testing and contact tracing has to be vital. I know the Arkansas Department of Health is working diligently to hire people for this. When we see an increase in cases above a certain threshold, we're going to have to back down. I've described it as kind of 2 steps forward, 1 step back. That's going to be really hard for people who have been, for the most part, cooped up in their house for the last several weeks or so. How long is this going to take? It's probably going to take a while because we're not close to getting a vaccine and we're still not sure about any good treatments. And so it kind of puts us in a bind, certainly as we start looking at the fall. The major concerns we have are compliance. Again, my own family is tired of being in the house. I hear about it at the breakfast table. Our testing is not that good yet, and we're still working on putting a system in place for tracking. The second peak, there's a concern that it could be higher than the first, and we're not quite sure what will happen this fall. If you look back at history, which again, we're hopeful we don't repeat, the Spanish influenza in 1918 had its worst death rate occur in the fall after the virus first showed up in the spring, dampened itself down in the summer, and then kind of came back with a vengeance in the fall. And so that's worrisome, and we'll have to kind of make sure that we do a good job of staying on top of it. Just real quickly, and I'm not sure how many of you have seen this or familiar with it, this is the White House gating criteria, and specifically this is what the governor spoke to that we don't meet right now. So we as a state don't meet this downward trajectory in terms of documented cases within a 14-day period. Some of that now is being thrown off by the prison population, so it'll be interesting to see how we navigate that. In terms of phase 1, ideally, if everything goes well, like everybody hopes, May the 4th, we'll move into phase 1. What does that mean? Well, it means that vulnerable individuals still have to shelter in place. They define a vulnerable individual as anyone with a chronic condition. So basically, if you take a medicine prescribed by a doctor for a chronic condition, or an elderly individual, which by definition from the World Health Organization is anyone 65 and older. Those individuals are still supposed to shelter in place. Talks about individuals in public and how do you manage yourself in social settings. It said, it talks about the number of 10. It talks about avoiding socializing in numbers of 10 or more. It talks about non-essential travel. For the employer standpoint, and this is where you get into what is the city of Jonesboro, what is this council going to have to do to try to help make sure that we do this right. Certainly continue to encourage telework, return to work in phases. It's something we're even discussing. I just got off a meeting just before here with our senior team at NYIT on how do we do this, avoiding common areas. Again, travel is a question. Specific employers, this talks about schools and organized youth activities. They're to remain closed at this point, so that means your K-12 and certainly undergrad will continue to be closed for the rest of the semester into the summer. It talks about large venues and places of worship. I've been asked to speak to a group on Thursday of local pastors and preachers to explain to them what this might look like and how do they change things within their own places of worship to make it safe for their parishioners and for their individuals that are coming for services. Elective surgeries, I know both hospitals are looking to get this back. Bars to remain closed. And I realize that was kind of fast and furious, and I'm happy to answer questions, but what does this mean for Jonesboro? At the end of the day, we have to make sure we protect those at the highest risk. So what do those policies and procedures look like for the different groups within the city? And you think about an individual, a firefighter or an E911 operator who's 66, or those in streets and maintenance in terms of maintaining social distancing. I say for the most part, we've done a great job. I've been in contact routinely with the Jonesboro Fire Department as well as the Jonesboro Police Department. They don't hesitate to call me if they have questions about individuals who might be sick or might be infected or came in contact with someone infected, and I think that's fine. Because I think it's important to have good information out there. Churches and places of worship are obviously excited about getting back as well. And so those are discussions we'll have to have individually to make sure that they do that safely. How do we host public events? And what's the general public guidance that the city's putting out for the population, the city and the county are putting out for the population? This is hard. I mean, this is hard. I mean, this is probably hard for you guys. I mean, I went to school for 4 years to understand viruses and microbiology before I ever went to medical school. And so, for me, some of this stuff just kind of makes sense, but it's hard for the average person. It's hard for me to even sit sometimes and explain it to my own family. And so how can we make this information more palatable and understandable for the general public so that we don't put ourselves in a situation that would be worse than when we started? And so that's kind of, just as a quick update, that's kind of where I was. I'm happy to answer any questions specific. Like I said, I know that's a lot to digest at one quick setting. I do these updates to for the city and the county every week. And I've been doing that for probably the past 6 weeks or so, and just provide an update for them. You guys got it all out of a fire hydrant at once. I apologize, but hopefully that gives you some idea as to the situation where we are now.
Okay. Any questions, ladies and gentlemen?
Dr. Speights, I appreciate you making that presentation. That was really good. I guess, should we be putting something out as far as education to the public as a city? Should we continue to, maybe a one-page infographic that helps explain that to people to make it understandable? Because I think you did a great job making it clear to me why we should continue to have things in place. But should we do something? Maybe we get Bill or somebody to put something out every so often explaining these are the reasons why we're doing social distancing. These are the reasons we need to continue to implement these things. So should we do something along those lines? What are some of your recommendations to us to help us make it clear to citizens around town?
So any education like that, I think, is going to be important and going to be vital. There's going to be so many questions. There's still questions on the medical side, on the research side. I'm reading stuff every day, almost every other hour right now. And it's like, wow, we didn't know it did that. There's a lot of new research coming out. So there's a lot of questions I have. And so that being said, I think the information that we do know is solid. We should put that out in a format that the public can understand. My hesitation right now, I think to answer your question, yes. I know the governor right now and their working group is in the middle of creating guidelines and specific overview of how the state of Arkansas should look. He mentioned that even in his press conference last Friday when he was asked, will this be a county and city approach or will it be statewide? And I believe, so that I don't misquote him, his answer was that there will be overall guidance by the state, but that obviously it's not a one-size-fits-all for every city and every county. I think you can never go wrong by putting out good information and good education. I think some of this stuff that I just described to you guys, I think is important in terms of, look, the virus didn't go away. It's still kind of smoldering in our community. And, people are going to get sick. We're trying to do the best job that we can in the absence of a vaccine, in the absence of good medications. We're trying to limit the people that get sick, specifically in the high-risk groups. So I do think education is important, and I'm happy to help with that as well.
Thank you.
I will say one thing, gentlemen. We do have, Councilman McLean, we do have the COVID-19 on our website. Obviously, the CDC and Department of Health, all of that he covered in some of those slides in there. But he's right. There's so much things that are moving so quickly on that that if he feels like that there's something we need to put on our post, on our website or whatever, that's good. I know that I think he's been on Channel 24, if I'm not mistaken, and talked about it. But it would be good for us to, and we stay with Dr. Speights every week, I can assure you that, and talk about this. And I'm always on there on Monday when he gives a report to the county judge and Anthony McCoy. and all of that. So it was a good question, and we'll certainly, but anything that he feels like that needs to be on our website, we'd be happy to do that.
Mayor Penn?
That was John.
Yes, sir.
Dr. Speights gave it was down and dirty, but it was a very, very good explanation. And a lot of people are having a difficult time understanding this. Would it be possible to present the presentation he just gave us on Channel 24 a few times a day so people could watch that at their convenience and maybe sit there, and if they had to watch it twice, they get a little better understanding of it?
Absolutely. We could do that, and I think he may already have that filmed. If not, we can film him doing that with the slides as he talks. We'll show each one of them, and we can run that. And then, like I say, any changes to that, we'd be glad to make them as soon as he wants us to do that. So great idea, and we'll get Bill and Campbell and with Dr. Speights, if that's okay with you, Dr. Speights, and we can film that presentation. So that's a good point.
Mayor, there's only one other thing. I hear this and hear this from people, and they equate this to no more dangerous than the flu. Could Dr. Speights address that?
Yes, sir. I'd be happy to. You know, it's interesting. I hear that a lot too, and I have to stop and that actually may be a separate segment on why this is not the flu. You know, one of the great things we have about, you know, with the flu is we got a vaccine. The other great thing is we have medications. We have really good medications for the flu. And so that really limits the number of people that have severe disease or that even die from the flu because of that. You know, people don't realize this either. We had a flu pandemic back in 2009. There was an H1N1 pandemic. And people didn't realize this. The CDC did a phenomenal job of getting test kits out within about 2 to 4 weeks across the country. And we even shipped them overseas to people who needed them. The reason why is because we already had a platform. We already did annual flu testing. So when you went in to see your doctor, they could do a flu swab, just like they do a strep screen or a monospot. And so we already had the platform available. Plus, we already had flu medications. And so all we had to do was kind of test them and see if they worked against this pandemic flu, which they did. And then because it happened in April, kind of like this, we're running this too, because H1N1 happened in April, we were able to rapidly turn around and use the same vaccine manufacturing process and get a vaccine out for the fall. So when it came back in the fall, we had a vaccine that we were ready for. This is a completely different virus. Our human bodies have never seen this virus. You've never seen this strain before. So creating the vaccine takes a year or up to 18 months, depending on which way we go, and make sure that there's no problems with it. We don't have any medications for it, and so that kind of puts us behind the 8 ball. The other thing is, gosh, it spreads so rapidly, and it spreads kind of like the flu. One of the slides I had up there, we're at about 42,000 deaths in just 3 months. So in a bad flu year, we have about 45,000 deaths over 7 months. And so we're hopeful that we don't see that this doesn't become just, you know, I mean, you can call it a really bad flu, but I mean, this is really just a separate entity. It's certainly a separate virus. It's not even the same family. So it's a different viral family, and it just behaves differently. Usually once you've gotten the flu, you get antibodies. You don't get sick with the same flu again. This virus is showing you can even have symptoms, you know, after you've gotten over it before. So we're kind of scratching our heads over why that is. Still a lot of questions and not a lot of answers. Does that help?
Yes, sir. Thank you for your guidance and your expertise in this matter. It's difficult for all of us.
Yes, sir. I understand.
Hey, Dr. Speights.
Yes, sir.
This is Joe Hafner. The question I have, and I don't want to get ahead to what we're going to be talking about with the curfew, but, you know, obviously, as you're saying, this is something new. We haven't dealt with it before. In your opinion, are people taking it serious enough? Because, you know, you go to the grocery store that's busy during the day, you know, maybe not even half the people are wearing their mask. You know, how do we deal with that?
Yes, sir. It's a mixed bag. I think the best thing that we can do is educate. I really do, because I mean, I don't see it. The governor got asked this today, and I agree with him. I don't see it being mandated that you're going to make people wear masks. I think you try to put up the best information you can and the best guidance, and say, look, this is the deal. You know, and just let them make their own choices. My son and I, we ran to Home Depot this weekend. Of course, we were both wearing masks, and we had alcohol for everything, but a lot of people there weren't wearing masks. There were there were a group full of teenage girls running around my neighborhood just last week. I mentioned this to Mayor. I'm worried about the juvenile spread because, they're not in school, they're not in high school, they're not in junior high, they're not in college, and they're just social at that age anyway. So they're grouping up and just running all over. They spread it quicker because they have less symptoms and they can be super spreaders of it. So that kind of worries me. But I think the best thing we can do overall is just continue to put out good education and guidance. I think people really won't take it seriously until we start having a lot more cases. This is really bad. This sounds bad, but until we have more cases and people die here. I've heard before that when you can talk about New York, you can talk about Italy, you can talk about these places, that's not here. And that's true. We just didn't want it. We don't want it to become that, but I'm afraid, and this is I feel bad for you guys in the position that you're in, trying to navigate this. But we've got to do something, for the economy. We can't continue this way. So economically, we have to move forward in some form or fashion. How do we do that as safely as possible and protect the populations that we need to, that are the most vulnerable? So maybe it's that we really hammer those groups hard and say, look, if you're in this list, you shouldn't be out and about at Kroger, or you shouldn't be out without a mask on, or you should carry hand sanitizer with you. There's a lot of different ideas that are being circulated now on how best to approach that. So I don't know, does that help? Does that answer your question?
It does. Because, and not to, like I said, not to jump ahead on our agenda, but in your opinion, is the curfew an effective way to help slow the spread? So
here's my stance. My stance is anything that we can do to slow the spread that's reasonable, then we should do that. But I am very cognizant of the economic impact. I'm very cognizant of the restrictions of trade. I would not be for things like that because we're talking about on the medical side. We're talking about the opposite piece in terms of, gosh, people are at home now. They've been that way for weeks in the social isolation. I've got medical students, we did this immediately. And so they're all in their apartments doing online learning, and it gets lonely. And there's a whole different psychology that occurs with that. And that, again, from an economic standpoint, certainly a rural state like Arkansas, we've got to get people back to work in some manner. So how do we do that safely? It's going to take some innovative ideas to say, okay, we can do this and this, and it doesn't really negatively affect commerce, but it still kind of gets to what we need to, which is to limit the interactions of people and to protect the people, that we need to the most. When early on when this was happening, I was really concerned about our fire department, to be honest with you. And I was worried because they were making all these medical calls, and they all cohabitate there. And so that's all you need is for one whole crew to get out. And we don't have a lot of depth from what I can tell on the fire department or the police department. And so we don't need to lose those individuals that are really on the front lines of protecting us. That's a roundabout issue or a roundabout answer. And I apologize, but I'm trying to be cognizant of the discussion without.
All right, I appreciate that. Thank you.
Thanks, sir. Any other questions?
Hi, Dr. Speights. This is Bobby Long. I got just a couple of questions for you.
Yes, sir.
You were talking about flattening the curve and how that helps from overloading our hospital system.
Yes, sir.
Got just a couple of questions and one term that I'd like for you to expound on. One, do we have any hospital census data that would let us know how close we are to reaching that overload capacity? And two, when we start talking about pushing that curve out, the same number of people are going to get it. It's just how compact on that curve are we going to be? But it seems to me that because the virus isn't going to go away, it's going to be out there when we open our community back up. So how do you address, right now everyone is staying at home or social distancing. We open up the economy, we come back in, spikes happen, we tell everybody to go home again. And then in the fall, the same thing happens again. And it just seems like we're putting ourselves in a situation where we just have this roller coaster of opening up, shutting down, opening up, shutting down. And we never, ever get to the point to where the virus has an immune population that it cannot host in. So given that, can you explain the option or the term herd immunity?
Yes, sir. Absolutely. That's a great question, by the way. Let me back up on your first question. Your first question was about the hospitals, and I meet every week with all of the CEOs of all of our hospitals in Northeast Arkansas, including our two major hospitals here, St. Bernard's and NEA Baptist. So that's a CEO working group that's talking specifically about COVID-19. They talk about tests and how their testing capacity is. They talk about bed numbers, and there's actually a statewide system called HaveBed. And so that's an electronic system that they can go on to, those individuals in that system, and they can actually look at where the bed status is for each hospital in the entire state. And so to your point, we know how many ICU beds we have. We know how many ventilators we have. We know what kind of our surge capacity is, for lack of a better term. It's a great utility. We've actually just added, we had them, and actually it was requested from Northeast Arkansas to add another column to say, worst case scenario, how many patients could you take if you needed to? Because our early conversations, as we were seeing this spike around the country and around the world, was that we were going to need some overflow capacity. And so I was working with Arkansas State University to create a secondary facility if our two major hospitals became overloaded in terms of how we might manage that surge, because we knew that Memphis, St. Louis, and Little Rock weren't going to take any. So that is a weekly meeting that is hosted by the hospital CEOs. I don't know the exact number right now. I can tell you that our bed numbers are fine. We do have COVID cases in our region. We do have COVID hospitalizations in our region. Again, because of HIPAA, I can't get into a lot of details there, but we have capacity right now. We have plenty of capacity, which is a great thing. And to your, I'll speak about herd immunity. So to your point, as we open things back up, as we open up the economy, as we start to move forward, then what we have to watch, and we have to partner with our hospitals to watch the hospitalizations. And as those numbers start creeping up, we've got to know when to pull back on what our requirements are, what our policies are. Because we can't get in the position of all of a sudden now we get to this point and it's too high, and we try to pull back, but we don't have enough hospital resources. And I think that's what certainly every state, every region is grappling with now, is how do you set that threshold? I'm hopeful that the state guidance that comes out in the next week or so will kind of point to that, because really nobody has said, okay, if you reach this point, you should pull back. You hit the nail on the head. People are going to be fatigued by this, and that's one of my worries, is that once we start loosening things and things kind of start going back to normal, so to speak, and you say, oh, wait a minute, we've got a huge number of cases, y'all got to back off. People are going to say, nothing happened last time. I'm not bought into this. And so that's a concern. Now, I mean, the virus doesn't care. The virus is just looking for the next host. In terms of herd immunity, it varies from virus to virus. The measles, for example, you have to have about 95% of the population has to be infected or have some sort of immunity for the measles not to pass around, which is why you'll see some outbursts here and there, or outbreaks here and there. Our best guess right now is between 50 and 65% of the population needs to be infected with this virus to create some type of herd immunity. Though we're not exactly sure if that's the right number, that's kind of the number that you see in the literature being thrown around. So half of the population or more needs to be infected by it. So how do we move forward? Again, no vaccine, no medicines, and really allow for half of the population to get infected, or make it so that the group that gets infected is not the high-risk group. These are the group. How can we have it so that the group that gets infected are the individuals that have the least likelihood of actually having, ending up on a ventilator, ending up in the hospital? It's not a good virus when you get it anyway. It's all, from what I've understood, and I get reports from actual patients in the Northeast, they feel horrible. A lot of them do, in terms of the muscle aches and the fevers and things like that. But and then some people have mild symptoms. But so how do you get those people infected, really largely your workforce, and protect the others? That's kind of the strategies that we're looking at from a state and certainly from a region, in terms of, those 65 and older, or those that take a medication, we need to kind of keep that population separate from everybody else as we start to reopen. Did that answer your question at all, or did it help?
It did. I was, back when you were giving your presentation, and we were talking about social distancing and keeping people away from one another and doing all that. It just seems like there are other options if we look at that. One being the herd immunity. And I totally understand because my mom and dad, they're 75 years old.
Yeah.
And I understand it, but they are taking precautions and they are doing those things that they should do. And I totally understand, about certain populations need to be more careful than others.
Right.
I also have to grapple with, are we just in a roller coaster? Because when you say vaccines 18 months away, some maybe even 2 years, I don't see us on this roller coaster for 2 years going, partially open, then pull back, partially open, and then pull back. So there has to be something else available out there. And
so I'm hopeful to just kind of pick up on that thread. I'm hopeful that we'll do a better job of finding some sort of medication to at least blunt the effects of it too. So maybe one of these medicines that we've already got out there, we can recycle and reuse, and maybe you don't get as sick with it. And so that's hopeful. And the other piece is too, we don't really know because it's still a new virus. It's only been circulating. We're kind of looking. The best thing that we can do, and I've said this from the beginning, the best thing that we as a community and we as a state can do is look at other states and other communities and see what they do because they're going to see it before we do. One of the luxuries about being in Arkansas is that we can see what happens in other areas before it really hits us, and we can respond better. And I think that's really why our curve is probably flatter in this state because as it was blowing up in the Northeast, I think that's what our governor and everybody got together and said we need to do a better job of containing this sooner. And so we put measures into place before other places would have considered it. And I think that saved us a lot. I really do. I think, I think the governor's done a good job. I think Dr. Smith has done a good job under the circumstances. This is a hard deck to be dealt to begin with. But
it is. Thank you so much. I appreciate your answers.
Okay.
Yes, sir.
Okay, any other questions to Dr. Speights? All right, if not, Dr. Speights, thank you, and Mr. Campbell will get with you, and we'll get that video and get it on channel 24 this week, okay?
Thank you. Thank you.
All right, thank you so much. Now, you can hang around if you'd like, All right, thank you very much, okay?